So today I'm going to be doing treatment with the Endolaser 120 to the shoulder joint. We're actually going to be treating supraspinatus tendinitis. Supraspinatus tendinitis can occur at the front of the shoulder joint or towards the rear of the shoulder joint or even in the middle. And so there are a few different ways you can actually place the probe. I'm going to be doing the front of the shoulder joint. And in this case we're going to be using a 4-point cluster probe. So we're going to be using the 400 milliwatt cluster, although we won't be turning it up that high. The reason I'm using the 4-point cluster is it's just more efficient. It's quicker to do it on the front of the shoulder because you can cover a large area, 4 centimeters squared in one go. It would be the same on the back of the shoulder where the cluster may well be the best choice. If you were going to try and get into the rotator cuff from underneath the bone, from the side, actually a single point probe may be better, simply because you get 1 centimeter squared. The gap just usually isn't that big in people, so the single point laser is usually better. You would have to do more points though, because obviously you've only got one laser diode, as compared to the cluster that I'm going to be using at the front here, which is a 4-point cluster. So if I come into the clinical protocols and then I start looking down the list, you'll see that here we have supraspinatus tendinopathy, infraspinatus tendinopathy. I'll go into supraspinatus. If you look at the overall settings, 4 points, 4 joules per centimetre squared, 16 joules overall, 4 times 200 milliwatts and 20 seconds. I'll just bring you back just to show you what the infraspinatus one would look like, and you can probably see they're the same. And that's because the treatment between the two tendons isn't different. And in fact, if you were doing the anterior, middle or even posterior of the joint, you'd find that either one of these protocols would be fine. You don't need to change the protocol if you're doing front, middle or back. The only time you might change the protocol is if you went up onto the muscles, in which case you may find that the infraspinatus and supraspinatus are obviously in different places, and so you would move your treatment onto the muscles depending on which one was the problem. If you're doing the tendons, actually it doesn't matter which one you choose, you can choose either. I'll leave it as infraspinatus for now, and as you can see here, this would be in line with the Walt guidelines. 4 joules per centimetre squared, 16 joules overall. We're doing 4 spots of 200 milliwatts. If you were on the 100 milliwatt probe, you would see it would say 4 times 100 milliwatts, and the time would just double. So in essence, what we've ended up here is just a slightly longer treatment session. Because this is only 4 spots, the whole treatment will be given over the 40 seconds. There won't be a stop-start in this treatment. We'll press OK and we'll go back to the patient. Seen now from the patient's perspective, I'm going to come on with the cluster at the front. This is going to cover a large area, so this is going to be a fairly straightforward treatment to do. You just cover the area with the cluster and turn on the laser. There's no need to move the laser, you're covering an area of 4 centimetres squared, and so this is going to be a very efficient, very quick treatment. Obviously, if you wanted to treat the supraspinatus down the middle of the shoulder, you'd actually use the technique shown in the subacromial bursitis video. And obviously if you wanted to do the back of the shoulder, then it would just be exactly the same as this, but from the rear of the shoulder. The cluster's efficient at doing this, but you can also do it with a single probe. That's not a problem. That would be the end of the treatment. If we were coming from the back of the shoulder to get the supraspinatus tendon, you'd be somewhere in this position here. It would depend where it was tender. Some people will put the patient's hand behind the back during the treatment to expose the tendon. It's not really necessary when you're using a laser, as it'll penetrate into the shoulder anyway. Back at the laser now. Start the treatment and you'll see the counter counting down and the applied joules counting up. If you look at the literature on laser and the rotator cuff, you'll find that most of the articles are very positive. There have been review articles as well and they've been positive. You tend to find that laser outbeats, it's the end of the treatment there, laser outbeats placebo and even laser placebo, so fake laser versus laser. But you'll also find that if you look at the ones that include exercise therapy, laser and exercise therapy together tends to do the best. So if you're going to give laser to the rotator cuff, I'd suggest using some sort of exercise therapy at the same time. That seems to offer the best results.